dietitian. She has her bachelor's in nutrition and biochemistry from St. Joseph College. She has an MS from Rensselaer in healthcare administration, and she's clinical nutrition manager at Middlesex Hospital, and she's going to be speaking on herbs. Sherry Bernier has her master's. She's also a certified hypnotherapist. She has her master's in counseling with a specialty in community rehabilitation. She's a second-year doctoral student at the University of Hartford in educational leadership. She's a nationally certified hypnotherapist, vice president of Sigma Phi Omega, a National Honor Society for Gerontology Professionals. And Marie Menu, our last speaker, was introduced to Therapeutic Touch 20 years ago when she studied with Dolores Krieger and Dora Kunz. As she studied healing touch, energetic healing, and Reiki, Marie began to integrate these modalities into her nursing practice. Her clients noticed improved healing of wounds, sprains, and fractures, drops in blood pressure, and relaxation of stress and tension headaches. Marie began working with Tibetan singing bowls and tingshaws 10 years ago. With these instruments, one can hear the change in tone as blocks in a person's energy field are identified. As Marie continues to work with the bowls and/or tingshaws, the blocks are broken up as the tone even out while pain is released. Marie also uses her bowl to focus meditation and visualization. These modalities work very well before and after surgery. She now combines sound and touch, which intensifies the energy directed to her client. She's a holistic RN. She's also certified in rehabilitation. And Marie and I worked together in rehab at Hospital for Special Care years ago. She's also a practitioner of therapeutic touch, healing touch, and sound healing. And she's also, and correct me on this correct pronunciation, is it Reiki or Reiki? Reiki master and teacher. Okay.
Hi, I'm Karen. And before we all start, I'd like to ask you to take your hands and just gently move them back and forth together. And just sense what you're picking up between your hands. Try to keep your head out of it. Just sense the feeling between your hands. Nice and slowly back and forth. Is anybody picking up any sensations? Yeah? What are they? Heat? A ball? Yep. Tingling? Yeah? This is the energy we work with when we use therapeutic touch. Now, with the touch therapies, a lot of people think they're all one and the same, and there's many, many different types of touch therapies. Matter of fact, therapeutic touch is kind of a misnomer because most of the time you don't even touch the body. So when you're talking touch therapies, it can be the healing touch, which Marie does, the Reiki, and she can talk a little bit about differences in them. And in my flyer, you'll see the differences between Reiki and the therapeutic touch. Healing touch incorporates a lot of different things in that. So the one I'm talking about today is therapeutic touch. It's based on a lot of ancient therapies from many, many years ago and was brought into modern use in the 70s at NYU. This is where Dolores Krieger was, and they had actually done some research at Pumpkin Hollow, which is right over in New York. And they did this because there was a friend of theirs whose horse had been very sick, and they wanted him to put the horse down. And he petted the horse all night, and the horse got better and recovered. So then they started doing research to find out, what is this? Why does this work? And that's when they realized that you don't even have to connect with the body. I don't know if any of you have you seen pictures of auras? The energy field around you? Or you've seen somebody walk by and you either like the way they feel or you don't like the way they feel? You're actually picking up their energy field. It can extend really close to us or extend really far out, depending on your mood, and it changes minute by minute. But that field is what we work with a therapeutic touch. Therapeutic touch is actually a nursing process. You center first, then you assess the field, then you break up any imbalances, and then you reassess. So it's an actual nursing process. Matter of fact, is there anybody, say in these 4 on the end, anybody who's having pain, discomfort? I don't want to know what it is, but how about over here? No volunteers? Okay, I'll take you. Do you want to come up? I'm just going to do a little demo. While I'm doing it, I won't be talking, but I want you to see what it actually is. So what I'm going to do is I'm going to center first, and basically all I have to do is rub my fingers together, and I center very easily because I've been used to doing this for a long time. Just use this. Let's go over here. Okay, so then after after I've centered, I'm actually going to assess her field. What I'm looking for is changes in the field because the body should be symmetrical. So it doesn't matter what the changes are I pick up. What matters is that they shouldn't be different. Like if one arm is warm, the other should be warm. If I pick up tingling, congestion, any kind of vibrations, I'm going to try to balance that out. Okay, and then after that, I'm going to, after the balancing, I'll reassess her field and see what I pick up then. This is going to be a very short session, so she may or may not feel anything, depends on how open she is, how much stage fright she has up here in front of all these people. None? Okay. And then afterwards, we'll ask her what discomfort she had before and how she feels after. Just close your eyes and put yourself in a really nice place. Okay, now that was very, very quick. But that gives you an idea of what therapeutic touch is all about. And actually, if you're in hospitals, 2 to 5 minutes is about the average time that you can accomplish something on a patient. It's okay if we talk about? Okay. Did you have pain before?
Yes.
Yeah? Mm-hmm. Can you scoot up a little bit so we can hear you? I'm dragging things all over.
Yes.
Yes, okay. Do you feel any different now after just a couple minutes? Did you feel anything moving, any kind of sensations? I'm not putting you on the spot. You can say no, because a lot of people don't the first time. Like I said, you're in a crowded room. There's tons of people around here.
That does, but my heart rate definitely slowed down.
Okay. Her heart rate slowed down, she says. Anything else?
No, I'm not uncomfortable right now.
And you were when you came up?
It was when I was sitting over there.
Okay. So she's not uncomfortable now. That was in a matter of what, maybe 2 minutes? That's why this is great for nursing to use this, because if you use it with patients, it is so quick. You know, I mean, you waste 2 minutes here and there anyway. You can waste it, well, not waste it, you could use it doing therapeutic touch on your patient, and when you have centered beforehand, you're going to be better off too, because you're going to be more centered. Can I tell them what I picked up?
Sure.
Okay.
Maybe
When I
not,
assessed her, yeah. I'll just tell you I picked up many imbalances in several areas. And on the reassessment, she obviously still had some imbalances because this is only a matter of minutes that we did this. But as you can tell by her response, she noticed the difference in just a matter of minutes. Okay, thank you. The other therapy that I do is craniosacral therapy. And that's why I brought my buddy Fred here. Anybody heard of the craniosacral therapy? I've had people come into my office and say, oh, so you're going to rearrange my head, you're going to make me look different. It's like, no. If you have a very crooked head, yes, by the time I'm done, you may look a little different after several sessions. Because this all started with osteopathy way back in the 1800s, when they decided that structure and function are related. So if you have a problem with your structure, you're going to have a problem with your function. Matter of fact, Dr. Sutherland would put a helmet on his head and had his wife take a look at the changes. There were cognitive changes, there were balance changes, there were behavior changes, and he'd tighten the screws. Yeah, would you like to be his wife? But anyway, that's how they decided that there's really a lot going on with the structure related to the function. Upledger took that a little bit farther. He was actually doing surgery on somebody who, this guy had a black toe, but he also had some calcifications on his neck. They scraped off the calcifications and his foot wound up getting better. However, during the surgery, Upledger could not hold on to the tissues. And the surgeon's like, I've got the hard part. All you have to do is hold on to the tissues. I'm doing the surgery. That's when he realized that there's a craniosacral rhythm, which is caused by the production and reabsorption of your craniosacral fluid. And you can actually feel it throughout the body. But the reason the skull is so important is because in your skull, you have membranes. So these are called falx and tentorium. And they're actually in your skull. So if you move a little part of the skull, you're actually causing an effect on this, which is why doing the surgery on his spine actually had an effect on his foot. Because it's everything that deals from the cranium to the sacrum, the spinal fluid, and then your body has all kinds of restrictions all over it anyway. And it's a very gentle touch of a nickel. I actually meant to bring some nickels with me, but if you just put a nickel like right on your hand, you'll feel that much pressure. So it's very minimal pressure and a lot of intent, but you can accomplish so many different things within the body. Okay?
Hi. As I mentioned when they introduced me, I am a registered dietitian. And when I went to school to be a dietitian, we didn't learn anything about herbals. It just wasn't something that was taught in mainstream schools. Of course, now it is. I could bore you for several days talking about herbal supplements. I really can't pack it all into 20 minutes. But what I want to talk to you about is what I think, the basics that you need to know about herbals in your careers, assuming that you're going to work in hospitals and convalescent homes. And the most important thing that you need to know, there's a couple of really important things, and one of them is that between 50 and 80% of hospitalized patients use herbal products of some kind. The reason that that's so important for you to know is because we don't ask that question. Most hospitals, if you go into the hospital and the nurse talks to you, they're not going to ask you specifically about herbal supplements. Now, some hospitals are starting to do that, but it's extremely important to ask the question in an open-ended way, in a way that the patients are willing to answer you. From my personal experience and from research that we've done, we have found that patients are much more likely to tell the dietitian, the nurse, and we actually did research on this, even the cleaning lady, they're much more likely to tell that person that they're taking an herbal supplement than they are their doctors, because they assume that doctors will be judgmental, and oftentimes, unfortunately, they're correct. So it is extremely important that you be aware of the number of people taking herbal supplements. And as a matter of fact, the older your patient is, the more likely they are to be on herbal supplements. People sometimes think it's the opposite. But seniors are taking herbals in ever-increasing numbers. And part of that is because they have time to do research. Part of it is because even if they weren't concerned with their health and wellness before, they are as they get older. And then lastly, they have the money to pay for them because they can get kind of pricey. So it's important that we be open to that and to communicate to our patients that we understand that they're interested in these products and that they very well may take them. There are a couple of major concerns as well with herbal supplements. The first and most important is that this is an almost totally unregulated industry. Now, you notice that in the introduction, I didn't say that I'm an herbalist. I am not a certified herbalist because there isn't any place that I can go in the academic world to become a certified herbalist. There are places that I can go, but there isn't any nationally recognized organization of herbalists. As a registered dietitian, I have a nationally recognized organization that, put me through, the test from hell to have those initials, and I have to do certain things as far as my education to maintain those credentials. There isn't any kind of a national association as of yet for herbalists. I'm sure there will be, hopefully in the future. This is a totally unregulated industry, and that's because, according to the government, these are neither herbs nor, medications nor foods, and they're right. They aren't. So the Food and Drug Administration has minor control over these substances because they are neither a food nor a drug. Drugs are heavily regulated in this country. Sometimes I think not heavily regulated enough, but they are heavily regulated. There is a process to go through. Physicians are required to report to the government if there's an adverse reaction with a medication. They are not required to do that with herbs. You may have heard recently that ephedra has been taken off the market. It's kind of interesting to me because ephedra has caused death and illness many times in the 20 years that I've been interested in practicing with herbs. The government didn't take it off the market until a sports figure died from taking it. And again, the government is very clear that they understand that this person did not follow the directions on the box. They wouldn't take Lasix off the market because they found out somebody doubled up on it, but they took ephedra off the market. Not that I'm promoting ephedra. I think it has to be used with great caution. But I have seen patients many times in my professional practice as a dietitian in large hospitals who have had adverse reactions to ephedra, but it just never seemed to get any attention. About 20 years ago, the government also banned the supplement L-tryptophan. And what had happened was a number of people got a nervous system problem after taking L-tryptophan, and a couple of people died. And the government's response was to immediately take it off the market. After they did the research, it turned out that it was not the L-tryptophan that caused the problem. It was actually the rat droppings that were incorporated into the tablets because, it was made in a hut in Thailand, and, they used every bit of the L-tryptophan, whether it had, nasties in it from rats or not. So, sometimes, the government can take herbals off the market, but other than that, they don't regulate them. And that's a concern for consumers and for herbalists. Basically, you really have to, if you're a consumer and you want to take herbs, you need to either do a great deal of research or you need to find an herbalist that you feel that you can trust because the government's not going to help you. The food industry is so heavily regulated that most foods have what's called a standard of identity. For instance, if you go to the grocery store and you buy mayonnaise, whether you buy Stop and Shop mayonnaise or you buy Hellmann's mayonnaise, it has to have the same, legally, it has to have the same proportion of eggs to oil. That's why Miracle Whip isn't called mayonnaise, it's called salad dressing. That's how heavily your food is regulated. However, herbals are not regulated at all. So, and that's, again, it's a concern because sometimes it's a specific part of a plant that has the therapeutic effect. For instance, ginger. It's the rhizome or the root part of the ginger that has the therapeutic effect that can help patients with nausea, help patients with vertigo, things like that. A company could legally use the leaves, which are, by the way, poisonous, put them in a pill form and sell them as ginger because there's no product of identity for those herbs. So it is very much a buyer beware market, and that's a concern. And one of the other things that they don't, because it's an unregulated market, the big concern that you're going to have as practitioners, particularly in hospitals, is herbal drug interactions. And the handout that I gave you is one of the best ones that I found for clinical practitioners to outline the concerns about certain herbs. Okay? Herbs can be very effective and very safe, but just like other medications that sometimes don't mix well together, herbs and some medications don't blend well together. One of the biggest concerns is for surgical patients, because there are herbals and vitamin supplements such as ginkgo biloba and vitamin E that actually, one of the ways that they work is that they work just like aspirin, in that they make your blood flow a little bit more easily. So if you've got a patient and you say to them, "Are you taking any vitamins?" and they say vitamin E, well, how much vitamin E should a person take? Well, it's about 200 to 400 international units. I had a patient who they couldn't figure out what the problem was with the patient. Was bleeding, and they couldn't stop the bleeding. Well, turned out that she was taking 1,000 international units of vitamin E. I just had a patient last week who's taking aloe vera, which can be a very effective herbal. You can take it topically for burns, but she was taking it orally because she was chronically constipated, and then she wound up having chronic diarrhea, because one of the things that we do in America is, if a little is good, more is better. And that's, again, part of the problem with the ephedra was it's a very effective weight loss product, so people took more because it worked well. And again, this lady was having a good effect with the aloe vera, so she took too much, and it never occurred to her that that was the problem. People think that because herbs can be bought over the counter, that they don't have any downside to them, and of course everything in life does. Okay. So it's important that that you know some basic information about herbs and vitamins. And again, the handout that I've given you has some very, very good information. The only problem with this particular handout is it doesn't talk very much about the benefits. It was written by a pharmacist, and its basic focus is the concern about the herbal drug interaction, and it doesn't talk that much about how safe and effective herbs can be, and they can be. Of course, all medicine started out as herbal medicine, and today's medicine, what they do is they take what they call the active ingredient in the herb, and they will isolate it, and they will use that. And that's not always such a great thing to do. Sometimes you need a specific part of the plant, but you need multiple chemicals or phytochemicals that are in that plant. It's called the synergistic effect. So sometimes you need to take the whole herb itself. And again, a good example is ginger. There was an article in this paper this morning. I didn't get a chance to read it, but it was talking about how ginger may be. They're just finding out, according to this article, that ginger can help lower your blood pressure. Well, people from India have known that for thousands of years, but it's new to us. But again, sometimes what the drug companies will try to do so that they can make money off of the herbals is they will try to identify that active ingredient. When it comes to nausea in a pregnant woman, generally speaking, drinking ginger tea is more effective than taking the dried ginger tablets or capsules. Why? We're not exactly sure, but clearly the liquid is better. By the way, on all of the herbal supplements, you will always see that pregnant and lactating women should not take any herbals. The reason that packages say that is because nobody will sue you like a pregnant woman. Okay. When something says it's safe for a pregnant woman, then it's really safe, because most drug and herbal companies will not take the chance of recommending it to pregnant women. I have used ginger tea extremely successfully for women with severe hyperemesis or vomiting during pregnancy. It's helped when nothing else has. But again, most doctors aren't going to recommend it because they don't want to take the risk. So if your patient tells you that they're on an herb, it's important that you find out from them how much they're taking, and it's tough because even with medications, I mean, I hear the nurses where I work, and they'll say to a patient, well, what kind of pills do you take? Well, I take a pink one and I take a green one. It's tough. It's a tough question to ask, but you need to get that information. You need to know. I usually ask them to bring the bottles in. It's usually the easiest way, because you need to know what part of the plant they're getting and how much of it they're getting. And knowing what brand is also very helpful, because generally speaking, you can get an idea of the efficacy of the processing of an herb based on the brand name. Because the government doesn't regulate herbs at all, some of us who are interested in herbs rely on what's called the U.S. Pharmacopoeia. The U.S. Pharmacopoeia is an organization, of pharmacists, and basically they go in, they inspect the companies, they make sure that they're processed appropriately, that the plants are clean, that if it says it has vitamin C in it, it actually has vitamin C in it. So that's a good way for you and for you to help your patients, to tell them to look for the seal of the U.S. Pharmacopoeia. There are good herbs out there that don't have that. Most Chinese herbs don't have that because they don't get bottled. They get made up by individual herbists and put in a brown paper bag. But if you're going to go to CVS and buy herbs, that's a way for people to at least have a starting place so that they have some confidence that what they're getting is a good product. Okay, thank you.
Can you all hear me? Okay. Hi, I'm Sherry Bernier, and I have many years' experience working in nursing homes, over 18 years as a therapeutic recreation director before I went back to school and got my master's in counseling. Along the way, as I was pursuing my master's, I had a professor who was a teacher in hypnotherapy, and I thought, what a great tool to have when I'm working one-on-one or in a small group of residents. I'm also a 6-year breast cancer survivor, and I wish that I had had this tool when I was going through chemotherapy. So that's an important factor that I gave you a handout that will take you through guided imagery. I'm going to do that with you in a few moments. But I just wanted to explain a little bit about the importance of relaxation and guided imagery when you are working with cancer patients. If I had had this tool, or if a nurse was able to walk me through some guided imagery before my chemotherapy, it would have been wonderful. For someone who does not have a nursing or clinical background, I didn't have any idea as to what chemotherapy was all about. And this would have really eased my way into sitting for the first time and having them put the needle into my port. It's also a good tool before someone's going into any kind of surgery, or after surgery, or when anyone is very nervous or anxious about going even into the doctor. I know that I do this. I do little self-hypnosis and guided imagery now before I go into a mammogram. Of course, after having breast cancer, I'm very anxious each time I have to go for a mammogram. So any tool that you can pick up along the way as a nurse is to be most helpful to your patients or residents if you are working in a nursing facility. What I'm going to do, I'm going to take you through some of these steps of the guided imagery so you'll get an idea of how you can relax in a very, very short period of time. And then after that, I'm going to show you how you can do a little bit of self-hypnosis for yourself, so you can use it at any time. So what I'm going to ask you to do is to just sit back, uncross your legs, unfold your arms, and just close your eyes and get into a comfortable position. I'm going to count from 3 down to the number 1. And with each number I count, I would like for you to take a deep breath. And each time I say the word relax, I would like for you to relax and allow the breath to rush from your body. With every number that I count, take a deep breath. And each time I say the word relax, I would like for you to relax and allow the breath to rush from your body. 3, take a deep breath and relax. 2, take a deep breath, and relax. 1, take a deep breath, relax, relax your thoughts, relax your body, relax your mind. Excellent. Now continue to breathe normally. I'm going to count from 3 to 1 again, and I would like for you to mentally release each group of muscles that I call to your attention. 3, release the muscles in your neck and shoulders. Feel your head slowly drop forward. 2, release the muscles in your back and allow your hands to fall comfortably to your side. 1, release the muscles in your stomach and feel the relaxation flow down through your legs and feet. Like a series of dominoes, all the muscles in your body begin at the top of your head and flow one into another as each one releases and relaxes. Excellent. Now I would like for you to imagine a wave, like an ocean wave, a wave of warming, soothing relaxation, rushing up over your body and rushing back down again, taking with it all the tensions, all the strains, and bathing you in a sea of warming, soothing relaxation, rushing up over your body and rushing back down again, bathing you in a sea of warming, soothing relaxation, allowing you to relax, causing you to relax, relax, and go deeper and deeper, deeper and deeper, with every breath you take, with every beat of your heart. Take a deep breath now, and relax, relax, and go deeper and deeper. Now I would like for you to imagine a path leading to a large garden gate. And as you approach the gate, you open the door of the gate and enter into the most beautiful garden you could ever imagine. The most beautiful place on earth. And as you stroll through this garden, what do you see? What do you hear? What do you smell? Now I would like for you to find a bench in this most beautiful garden. Sit on that bench. Feel the warmth of the sun on your face. I am going to count from 1 to 10, and with each number I count, you will slowly awaken, feeling relaxed and refreshed. 1, 2, 3, 4, slowly coming up 5, 6, 7, 8, 9, and 10, feeling relaxed and refreshed. And I hope everybody is awake now. This only took maybe 5 minutes or so. And if you have 5 minutes to spend with someone who's going into surgery, this is a very easy tool that you could use. Are you all feeling relaxed? It's very, very easy to do. And if you ever want to do this with yourself, I know that I do it, like I said before, a mammogram or before I go for an exam, taking a test, academic test. You just take your hands in your lap and you just take your fingers and close them up so that the energy is staying within you. and close your eyes and count from 1 to 10. And what I imagine, each number that I count, that I'm taking a step. There's a staircase of 1 to 10 steps, and there's a large double door. And when I reach number 10, I open up the door, and I'm in my most beautiful place. So it could be different for everyone. I just use the garden so that you would have an idea, but you can go to any place. For some reason, when I first learned this with my professor, my favorite place was always taking a walk in the fall. Fall is my favorite time of the year. But for some reason, I was in Africa. And from that moment on, I just love anything to do with Africa, with the giraffes. And it was really, I was really surprised that that's where my place was. So everybody has a different place. And when I do this in groups, I do this for cancer support groups. I ask them where their most favorite places, and you get such different things. One was somebody was with a rock star. Somebody was at Disney World. So it depends on the person. To me, being at a rock concert would not be relaxing, but to somebody else, that was relaxing. So everybody has their own place. So I'm just giving you these tips to use for yourself and for your patients or residents, and it's really, really wonderful tool to have. The hypnotherapy is one step. I took you to guided imagery. Hypnotherapy would be one more step further into it, where I would give you hypnotic suggestions. If you wanted to quit smoking, if you wanted to ease anxiety, that's what hypnotherapy is. It's just one more step beyond the guided imagery. And thank you.
Good afternoon. I'm Marie Manu, and I'll be presenting Reiki and Sound and Touch Healing. Now, if you picked up all the things over here, you will have a sheet on Reiki, and it described what Reiki is. And this was prepared by my Reiki master, Barbara Schaefer, and I loved it so much that I had a copy and just bringing it to you. By the way, I am also an alumna of this wonderful institution. I graduated in 1981. Miss Rosa was my teacher too. And I loved her then too. So these are the things you could do after you graduate. Okay, so the top of it, if you just get this piece of paper, it says, what is Reiki? Reiki is the Japanese word for universal life energy. Rei means universal, transcendental spirit, power essence. Ki is the vital life force energy. The Chinese call it Qi. In India, it's prana. And we refer to it as God, the light, the many things which are the breath. And that's in one of the handouts too. So when you just breathe, just take a deep breath in through your nose, let it out through your mouth with a sigh. Try it. If you do 3 of those, it lowers your blood pressure. I found that out in my practice. I was working with people from New Horizons Village, which is an apartment complex for severely disabled folks. And Reiki, though is not a religion, it holds no creed or doctrine, but it began centuries ago in Tibet. Many things began in Tibet, as the bowls did as well. We all have this energy at birth. We just lock it up somehow as we're growing up. A little baby, they're just so open to things. But as we grow up, we realize we have to protect ourselves against things, so we build walls. And what we're doing here in complementary alternative medicine or integrative medicine is to release ourselves and to let this wonderful energy come up from us and we can experience coming into it. When we do Reiki, I started out with therapeutic touch, as did Karen, and healing touch. But Reiki has more. It has attunements and symbols, which, how should we say, just increase the energy. There are other things which increase the flow of energy too. Reiki can be done by either touching someone or hands off. Could I have another volunteer? Oh, come on, surely there's someone who wants to have a little Reiki. Come on.
Michelle.
Okay. So what we're going to do with Michelle here, thank you for volunteering,
Okay.
is I'm going to do pretty much what Karen did and just assess her also. Then do some Reiki on her and then reassess. Is there anything special you'd like today? No? Great. Okay.
Yeah.
Put your feet flat on the floor. Take a deep breath. Michelle? Did you enjoy the experience?
Yeah.
Good. One of the things you notice is that, I don't know if you can see it in the back so well, but I did touch her feet in the end and just sent energy into her feet to ground her so she can walk back okay. Thank you, Michelle. Might as well sit down. We use the Reiki in the hospitals now. There is Reiki on the staff at Hartford Hospital. And sometimes you'll find nurses who do Reiki can just do it with their patients. As with Karen, it doesn't take very long. It works well before and after surgery. Any of the any of the energy work works well. Before surgery, when we're fearful, we're scared. Any intrusion into the body is a scaring procedure. And so you need to talk to someone about it and just relax and then get the worries out. I've worked with people with the bowls before surgery and after, but Reiki also during it. I would work with his wife too. While he was in surgery, I worked with her. He came out of surgery, we worked with him a little bit on Reiki, and then he wanted to go home. It was day surgery, but he was fine. When you do therapeutic touch, healing touch, Reiki, bowls, it helps to heal faster with less bleeding and less pain. That's one of the good things about this. Now, I will do a meditation, as did Sherry, but this time I'll use the Tibetan singing bowl. I got this one at a Tibetan bazaar when a monk was here doing a mandala at Trinity College. So this was made in Tibet. They have about 7 metals in them. Like Reiki, the bowls were made somewhere 4,000 years ago, and Reiki probably went back 6,000 years. These are very ancient healing modalities. When you use a bowl or tingshas, you've seen these before? Probably. Well, sometimes it's like you can call this to a meeting. Could I have another volunteer and I'll do a Reiki, or not a Reiki, but a tingsha demonstration? Sure, come on. Once you get a bowl going, you really don't stop it. But Daleen, thank you for coming up. Okay. What I will do is I will do an assessment on Daleen using the tingshas in the Eastern tradition. And then I will just go down and do healings. You will hear, you listen very closely, and you can hear a difference in the tone in some areas where there are blocks. And we'll work one out. Do you hear a variation in tone? This was at her left shoulder. Put your arm down flat. That's it. Another one. How was it?
It was fine. You found something over here?
Yeah.
Oh, I usually have tendonitis in the shoulder, but it hacks up more at night. I don't feel it during the day, really.
Okay, well, it was there during the day, too.
Oh.
Thank you. Dawn, how much time do I have?
Probably about another 5 10 minutes.
Okay. What I'd like to do would be to just, as Sherry did, this will be a meditation. And while I'm circling the bowl, I will also be saying where the bowl came from. And so that'll also be a meditation and history lesson all at the same time. Is that okay with the microphone? The sound of the bowl is the sound of the void. The sound of creation. The sound of energy becoming matter. The sound of the Creator. The sound of male and female. Male and female, when put together, work together, and having them come together in harmony brings you to enlightenment and joy. There's 7 metals in this bowl. There's gold for the sun, silver for the moon, copper for Venus, iron for Mars, tin for Jupiter, and lead for Saturn. Allow your eyes to close and just feel the energy. Feel yourself focusing. Focus on your body. Feel your body, your heart. Feel the love in your heart. Take a deep breath and feel your lungs. Feel your arms and your hands. Feel your legs and your feet. Let yourself just be. Notice that you're feeling good. And there will be snow this evening. Visualize the snow on the trees, sticking to each little twig. And there is silence. And there is beauty all around. The snow is like diamonds, sparkling on the trees, the bushes, all over. Expand your imagination. And as you go with the snow, go to where it came from the sky. You can go up and up into the night sky, above the clouds, above the earth, beyond the moon. feel very expanded and at peace. Now we come back to our planet, past the moon, into the night sky, down to the clouds, and become a snowflake dropping down. Then you slide gently into your body and into your seat. And you wiggle your toes and you wiggle your hands, move your shoulders, and come back to your nursing class. Welcome back. That's it. Huh?
Well, I'd just like to thank all of you for an excellent demonstration, but I'd like to offer an opportunity for the students to ask any questions.